on people's knees, but I'm taking them away right now because I'm going to be aligning the knee and the hip a little bit differently to a better alignment than what is naturally happening here. And you just relax. You can see the rotation in the leg go and the position of these knees so that the feet are completely different. So if you're working on that with people, you do want to make sure that when they are laying on their stomach, that their legs are aligned the best. And that's another reason to put the bolsters at the ankles so that there's a little more play there, so the knees can rest in alignment. This one is a little bit still off, and you rotate it from the hip. You don't wrench the knee over, but you rotate it from the hip, giving a nice straight look. And then the feet look like if they were standing on the ground, there would be just a slight turnout of the feet, which is good. Just a little turnout. They can be square, but if it's not lining up with the knees, then it's better to have a little bit of that work and keep the hip and knee in alignment. Working with, of course, with massage, you always want to start the work down distally, or the farthest from the center. And the reason for that is the circulation. You work primarily with the cardiac circulation, the blood flow. And you want to move it toward the heart. So you don't want to do strong motions downward, although you can follow it down lightly. You want to make the direction that you have a little more pressure going up toward the heart. Now the calf sometimes can be very, very tender because they do get tight, and sometimes that'll bring a person up off the table if you go in too deeply, too quickly to the muscles. It should be able to be worked a few times, and then the muscles should relax out. There is things that I have been told, I've never really had this experience, but I have been told if you squeeze the calf real tight and there's a lot of very, very severe pain, that there might be some kind of a thrombosis or a blood clot or something in the leg. So if there's unusual amounts of pain, then be careful. You don't want to massage if there's clotting going on. That's not a wise thing to do. So just pay attention to anything like that, and if any unusually loud or intense type of pain comes, slack off and just maybe avoid it, or use your intuition, use your good common sense as to what you should do. I don't see that kind of thing myself. I don't work with that so much. So I haven't had to modify anything around that particular thing, but I know that if it did happen, I would probably avoid massaging in the extremities, and I would probably resort into doing some cranial work and just get the body relaxed, but basically avoid anything like that. And then of course the hamstrings are the other group that are tighter. Postural stuff that we do doesn't usually stretch these out very well unless we do a lot of leaning over. These muscles are important to keep stretched because it does attach into the hip, and also the quadriceps, the front of the thigh, should be also stretched. Those muscles should continually be open to keep the hips open, and also the low back. Some low back pain is oftentimes caused from tight muscles down here in either the hamstrings or the quadriceps. So another reason to keep your body active with some sort of movement. Stretching, taking the joints in the complete range of motion, whatever that range of motion is for you, even down to the toe. So if you're working with a massage therapist, they should also do some joint manipulation, range of motion, because it is important to move all the joints. Especially as we get older, just because we do get older doesn't mean our joints, we can still maintain a good level of flexibility. And when we're more flexible, we're less likely to be as injured if we should fall or trip or step in a hole or something like that. And if the muscle is also strong, then we can hold ourselves through those kind of little accidents better, or we'll heal quicker. So there's a lot of advantages to taking the time to stay connected in with your body and feel what it needs and give it what it needs and take care of it, because after all, it gets you around. And there's the calf work. And now here on the leg, you know, there's a bone in the front of the leg that's pretty much the whole front of the leg, but there's muscle along that bone, and a place that's oftentimes missed is right along that bone where the muscle comes into it. It's usually missed, and I think that's a really good place to get in and make sure that everything is moving and it's very pliable and there's not a lot of knotting in there. And then the hamstrings, that's a group of longer muscles, and there's three primary ones, and 3 are considered the hamstring group. And you can, when you look at an anatomy book and see how they're placed on the leg, you can work each muscle on the edges of each muscle, and you can start to feel the definition of the muscles when you know the anatomy well. Sometimes it feels like they're all kind of together, but they're really not. If you develop your hands in a way to find these things, you'll find them. You'll get the anatomy down pretty well. You just give it a little bit of time. So then, of course, range of motion. The foot, I don't know if that's going to bring it up too high. I'll just do it here. You can take the ankle in many different directions. This is already a little bit tight going this outward direction, so. Now with the feet, you can do little exercises yourself on the ankles. When you're just sitting down, you can just rotate your ankle one direction and then the other direction, or side to side. And strengthen this side of the leg is the side that will get weaker, because these muscles to hold the foot that direction, they aren't as strong as the inside muscles. But you want to keep a good heel strike and keep the alignment good in the feet and ankles, and your knees and hips can hold out for quite a while. It's all in alignment. And it's all in keeping those muscles somewhat relaxed so you don't get tight muscles on one side and twisting and torquing going on to take that out. The alignment not only is important just for the structure, it's also important because when you're aligned structurally, your organs are going to fall into place better where they need to be. When there's a distortion of the structure, then everything inside of that structure is going to be somewhat distorted. So another reason to pay attention to those core strengthening muscles